So with that preamble, I'd like to bring up a couple of cases and just have a little discussion. So I'm going to sit down here and we'll do this. It's going to be pretty informal, so like I said, if you've got anything that you want to contribute at any point, then feel free. The first one I'm going to look at here is Liam. So I'm going to orient you a little to some of the fields that we're looking at. This form here contains the clinical information for Liam's case. On the left-hand side, you can see the summary of findings in this whole region over here, which is a summary of what we've got going on in his case with his symptoms, his history of trauma, and drugs he's taking, and the exercises he's been doing. The results that we've got from his x-rays and his posture analysis. Over on the right-hand side, you can see the recommendations that we have for what we want to do in his case. So this is where I've designed his program of care. If you look in the top part here of this right section, you can see there's a case summary. And this case summary section is the single most important part of your record when it comes to your medico-legal notes. When it comes to having records that you want to present in a court of law, or you have records that you want to present to any sort of third party, this section here, the case summary, if you have all of these fields completed, then you're going to have a very thorough documentation of what you do in your case that anybody will be happy with. Unfortunately, most chiropractors don't do that at all. The second one is comorbidities. And you can see that that's actually blank in this case. I'll go through each of those fields actually. These fields have been developed in conjunction with the WCA because the WCA has spent quite a lot of time defending chiropractors in court. And unfortunately, there's been many occasions when a chiropractor, for a lack of recording what they did, have come unstuck in court and ended up suffering large penalties. That's not because they necessarily did anything wrong, but because they didn't record what they did, or they didn't record the thought processes that were behind their actions. Sometimes you can do something that's perfectly the most logical thing to do with the case you've got, but turns out to be a wrong decision further down the track. But so long as you're thinking clearly in the process where you made that decision, that's okay. But if you haven't documented that, if you haven't shown that you thought things through before you jumped in and dealt with the case, then it's a different case. It's viewed very differently when it ends up in a court of law. Now, we don't really want to have to spend our time creating our records so that we're just writing for somebody else, or we're writing for the very rare occasion where we might end up in a court of law. But the truth is that if you do, and it happens, unfortunately, in the course of a practitioner's lifetime, it's pretty likely that it's going to happen for each of us at some point. As compliance requirements go up and litigation tends to increase, it's only going to become more likely. The 2 minutes that it takes to complete these fields is just so critical to making sure that everything is properly documented in your case. Interestingly, some of these fields, when we created them, Pete's saying, oh, we need to have a comorbidities field. It's really important we have it as a separate field. I said, no, you don't need it. You can just put it in as part of your diagnosis. And he said, no, it's really important that we have it because of this particular case where which he'd been assisting with. And now that it's in there and I've been using it, I actually have changed my mind about it completely. At first I thought it was just something I was doing for somebody else, but as time has gone by, I find it's actually really valuable for me to stop and think, what has this person got going on that might be a significant disease process that could affect my decision making in this case? And I just make a note of it right there. So it might be, for example, they have osteoporosis, or it might be they have cancer, or it might be some kind of serious disease process that's going on in the background, even if they've got a history of stroke, something like that. So we want to fill in these fields. It's really critical that we do, but we want it to be quick and easy to do. You can see in this case, Liam's diagnosis is pretty simple. He's got a healthy spine. That's really nice. He didn't used to have a healthy spine. If we go back to his original diagnosis, we can see that he had a chronic lumbar spine scoliosis, convex to the left, complicated by one leg being shorter than the other by 6 millimeters on the right. Well, that's inconvenient, causing low back muscles, splinting, spasm and pain, and altered lower limb biomechanics. Also, chronic post-traumatic total loss of the normal cervical lordosis with dramatic displacement of the atlas 44 degrees from normal alignment, causing impaired motor coordination and distortion of the lower limbs. So that was my original diagnosis. You can see it's pretty detailed, yeah? But the amount of time it took me to put that together was about 45 seconds. Because up here we've got the dictionary, and you can see all the entries that we have in the dictionary. And so for me to be able to create this statement that we have down here, all I have to do is mix and match and pick the items out of the dictionary above. So it's literally a point and click and I create a new statement. I'll give you an example of what I mean. We'll just delete this one. And we can undo that change in a minute. So let's say that I determine that he has chronic post-traumatic cervical subluxation of C5, complicated by loss of the cervical lordosis, causing cervical spine muscle spasm, splitting and pain, complicated by thoracic hyperkyphosis. So that's pretty easy for me to do. It's just a point and click. It only takes a few seconds, yeah? But you can see that what comes out when we produce our clinical record, if we produce a report for any third party, is a very thorough, correctly spelled, grammatically correct, considered diagnosis. Let me just reject that change so we go back to what we had before. And we'll go back to his most recent. So you can see how this is evolved. You see where originally there was just the diagnosis field, and as time went by we added these extra fields. So now I'll always complete every single field for the patient. In this case, the comorbidities field has been introduced since this file was last reviewed. So it's actually blank. In his case, the comorbidities would be none. But if you've got any blank fields there at all, it means that your summary of your case is not complete, and you want to make certain that it always is. So say we want to give him a cervical extension exercise. In fact, in his case, I might give him a cervical traction, a wedge exercise, and I want to put it at C1. And say I want to give him a cervical strengthening exercise. So we can add that one in, and say I wanted to give him a lumbar strengthening exercise as well, because he's still, when you look at his AP view, his lumbar spine is not fully straight. So we give him some lumbar side bridge strengthening exercise, and then his exercise is designed for him. The actual exercises, when we produce them, I don't normally do this, you see. It's done by my CAs. But if we were to make
TV traction.
TV traction. So if we have a look here, you can see that this is the document that's been created in his case and been given to Liam to take home. And it describes the exercise, how to do it. There's a photo showing how to do it. You can see there's a picture of his actual x-ray. So this is his x-ray with his line drawing on it. So when he goes home and does his exercises, he can know exactly why it is that he's doing his exercise. It takes maybe about 30 seconds to create, and your CAs can do it for you.